Hello everyone, this is Dr. Prarthana, Assistant Professor from the Department of Public Health Dentistry, Vinayaga Mission Sankaracharya Dental College and Hospital, Salem. Today I am getting into the insight of a very interesting topic which is more dry, but it is more interesting according to me. So we'll get into the topic. Today's topic will be health economics. So our basic lesson plan today will be, at the end of the session, be able to know the various economic evaluations and the basic concept behind the health economics. We'll be covering off the introduction to the health economics and the concept of health economics, factors influencing the health economics and the various types, which is very essential according to me, and we'll go into a bit recap. First, the basic concept, we'll jot the health economics into two. So health economics will be jotted into two concepts, health and economics. So coming to health, we all know according to WHO, which is a state of complete physical, mental and social well-being and not merely absence of disease. And what is economics? So economics is a science of scarcity, meaning in a country like India, we have a vast population, but we have the resources but in a very scarcity amount. So how well we'll utilize this resources? So this science behind is known as the economics. Economics is a science of scarcity. It analyzes how choices are structured and prioritized to maximize the output from the constrained resources. So what is health economics? Combining these two frameworks, which we already have explained, it's a logical explicit framework to aid in the healthcare workers, decision makers, the government and the society to make a choices on how best to use these resources. So we have to utilize the available resources to get a better outcome. So that is the concept behind the economics and as well as the health economics. So health economics will be based on the three main concepts. So first, the quantification of resources. How well we'll quantify the resources. So we have the available resources now, but we have to quantify. Like we have to wait what is high and what is low. And after quantifying the resources, we have to find the efficiency. Like how well it can be effectively utilized for which population. So that has to be initially done. And a very interesting topic which we'll discuss today is equity. The health economics and economics should be based on the equity rather than equality. We'll find the difference very soon. Before going into the concept of health economics, we'll know what is cost. So cost is something incurred in a purchase of a product or a service. Then what is the difference between cost and price? Cost is something which is jotted by the producer or the maker, but the price is amount which is the consumer is willing to pay. So it is from the consumer side. That is the difference between the cost and the price. Then what is direct cost and indirect cost? Direct cost, as the name suggests, it is very direct. So whatever we pay or incur to purchase a product or a service is known as the cost. But indirect cost, we are not directly getting the product or service, but we are benefited from the service. For example, we pay the rent where we are benefited, but we are nothing there getting it or a product or a service. So that is the indirect cost. So coming to equity and equality. Let's say for example here, the three people are standing there to watch a cricket show. Here, the one is very short, the other one is very tall, one is of medium height. According to the equality concept, everybody should get the resources equally. So we are giving three people, three equal size table. But the end result, the shortest still cannot see. The longest or the highest will be able to see. There is no difference. So what is the benefit from the equality? But in equity, here a very interesting topic should be analyzed, which is need assessment. We have to find initially what is the need for all the three people. The highest will definitely not require any table to stand on to look on the cricket. He is very well good in his table. And shortest will need an additional table. So we are given with two tables with the shortest, and the middle one will be given the single table, and the tallest will not be given any table. But the end result, all the three are able to watch the cricket show. So this is the concept behind equity. Equity is the major backbone of the health economics. And we'll know something about the macro and microeconomics. Macroeconomics, as the name suggests, is the outline of the economics. It's the study of total economic process rather than individual concepts. While microeconomics, we will go one by one, individually, interiorly. So it is more of the production, consumption, the distribution aspects of economic activity. So what are the factors influencing the health economics? Well, while analyzing the health economics, we need to know various factors. For example, the initial maker is the government or the policy. They will be influencing the health economics. And there are some information discrepancies all over the world, and especially in a country like India, where we have vast population and we have some information asymmetry. It can differ from state to state. And there are various barriers to entry. For example, some people were very interior or remote areas where the resource cannot be allocated that easily. They need a special strategies to get the resources to them. So all these factors are influencing the health economics, which should be considered before planning an economic evaluation. Coming to types of economic evaluation, the major topic of today's concept, we have 4 types of economic evaluation: cost benefit analysis, cost utility analysis, cost minimization analysis, and cost effective analysis. Cost benefit analysis. So as the name suggests, it is something incurred to get the benefit out of it, but it is more measured on the monetary basis. For example, if we are paying something, we should also gain something on the money aspect. For example, let's take in the dental aspect, children who had their first dental visit by age 1. So some people had their dental visit by age 1 and some people did not. And a study shows that the annual cost that they spend in dentistry is lesser for children who visited the dentistry at the age of 1 than that of the older ages. So older ages spent more in the dentistry. So they have more loss when compared to children who had their dental visit at the age of 1. So this is the concept behind the cost benefit analysis. So cost benefit is the tool modern financial analysts adopt before undertaking any financial operation. So any system in organization must produce more benefit as compared to its cost for the organization. So cost should not be the main concept. There should be more benefit. So that is the concept behind the cost benefit analysis. Coming to the cost minimization analysis, it's a very simple concept where 2 medications are given, for example, medication A and medication B. But the end result should be same. There should not be any difference in their result. And for example, they can be of different brands of same generic name. So end results are same, but we have to find which is of minimal cost. So which is very basic. So minimal cost with better result is supported here. Cost minimization analysis compares the cost of 2 similar interventions to ascertain which is less expensive. So it is used to compare the cost per course of treatment, while the alternative therapies have demonstrated equal clinical effect at a lower cost, and used to compare 2 products that have been shown to be equivalent in dose and therapeutic effect, comparing generic and therapeutic equivalent drugs. This is some example showing that primary oral health care clinic and outreach service dental service. So these 2 are compared here. A comparative analysis of cost spent in the primary oral health care and outreach service. A comparative analysis of cost expended in the treatment of patient at outreach dental service of University College Hospital, Ibadan. Here the results showed 342 participants attended the outreach program, and more than 80% had unmet oral health needs. An average cost of outreach, this is the main aspect here, average cost of outreach per patient was only $2 versus $4 in the primary health care program. If their patient had been admitted in the primary health care, their cost will be $4.13, while in the outreach program it is lesser with of same benefit. So this is a concept where a lesser or minimal expenditure concept is utilized here. Coming to cost utility analysis, it is used to measure the interventions with multiple outcomes. Here our benefit is based not only on the monetary basis, like not only on cost, but on the quality of life and the quantity of life. So it is more of non-monetary basis. Here an important unit which is used is the QALY. So cost utility analysis utilized quality associated life years. Here it is calculating the survival time and the changes in the quality of life. So for example, let's take a cancer patient. This cancer patient has been given a treatment which had increased their lifespan for 5 years, but their utility value was less. For example, they are living a better life, they are living a movable life, but not to the fullest of a healthy people. So we'll take the utility value as 0.5, so which will give only 2.5. So their cost utility analysis is 2.5. So this is a very important concept usually utilized by the economist to find the quality associated life years. Coming to the major economic evaluation, which is cost effective analysis. The economic study design in which the consequence of different interventions are measured using single outcome. Usually it is measured on natural units. Actually this and cost utility analysis both look similar, but cost utility analysis is more based on only non-monetary basis, but cost effective analysis takes input of both costs and also the non-cost products like natural units like life years gained, death avoided or case detected, etc. So for example, let's take in dentistry we have sealants and fluoride varnishes. Both prevents the caries, but in a systematic review they have been found that total cost per sealant was only $110 and total cost per varnish was $44. The ratio was 1.33. The varnish is cost effective and caries reduction of sealant is 76% and in varnish is 43%. So what does it infer? So cost of total sealant application incurred was 104. For fluoride varnish is 44. So basically fluoride is cheaper when compared to the sealant application. But the benefit of sealant is 76%. But for varnish it is only 44%. So it is differing in a total concept. How will we find which is effective? We have to take into account of both cost and benefit here. So for which we will find out the average cost effective ratio. Average cost effective ratio is the ratio between the cost and benefit. So this shows that sealant has $137 per reduction of caries, while varnish only $1 or $2 is spent for the reduction of caries. So definitely varnish will be better effective than the sealant. When we make all the economists sit end to end, there will be no conclusions. But today we have a conclusion that constrained resources and raising healthcare costs is the major backbone behind this economics and health economics. So we have to utilize the reduced resources with the raising healthcare costs to the benefit of the people and the community. So health economics is a very valuable tool for improving this information on healthcare decision. So today we had a concept on cost, the difference between the cost and price, what are the factors influencing the health economics, and what is health economics and what is health and economics, and majorly we have classified the various economic evaluations of 4 types. So that comes to an end. Thank you. Thank you all for this patient listening to my lecture.